Hello, welcome to my channel. My name is Alison and I live in Norway, trying to live my best life, and I'm sharing my experiences with you. Well, I hope to share my experiences with you. So if you're just new here, thank you for dropping by. Thank you for all those that watched my previous video. Thank you for subscribing. Like, I saw new subscribers. I was so overwhelmed with joy. I was so grateful. Like, wow, somebody finds my video important to just spend a minute or two. So really, if you watched my previous video, if you subscribe, I am super grateful. I thank you. I do not take you for granted. Yeah, so let me go straight to the reason why we're here. So if you watched my previous video, essentials that you can pack in your hospital bag, which is like up, you should be seeing the card like here. Yeah, you can go on over. If you haven't watched that, you can run over and watch it and catch up on all the updates and stuff like that. Yeah, so in my previous video I talked about the essentials you need in your hospital bag, and I listed some of them in the description. So if that's something you need, you can go over there and check it out. Well, in this video, like in my previous video, someone said, oh, they wanted me to share my experience giving birth and stuff like that here in Norway. So I decided to make this video. So initially my plan was to just make a video about the healthcare system and my birth story in one, but I just figured that would be really long and I wouldn't want to keep you here for so long. So I'll just be making like a proper birth story video in another, like create a proper birth story video and upload separately. But in this particular video I'll be talking about like the healthcare system here in Norway, from my personal experience, of course, and then possibly one or two things I have learned along the way. So I just hope it will be helpful. So let's go straight to the content, why we're here. So healthcare in Norway in general. First off, in this video I will be talking about before birth and then my after birth experience. So I'll just try to segment it into two. So yeah, before birth, sorry, something just I don't know what's going on in my eye. Okay, so before birth, when I arrived in Norway, it was like it was 2020. It was like after the COVID, so just everything was just, the system was gradually picking up, but then there were still restrictions and all that. So immediately I landed into Norway, I was taken to a room where I had to like do my COVID test again, even if I had done COVID test from my home country. It was just so important because the government was like trying to manage the whole situation and all that. And I was also asked to like stay in isolation, in quarantine. Yeah, that's the word, for like 10 days or 15 days thereabout. So yeah, I stayed in isolation. Oh, sorry if I just keep doing this with my eye. I don't know what's going on with it. Yeah, so I stayed in isolation for a couple of days. It was so boring, trust me, because then it was Christmas and everybody was at home, but everywhere was extremely beautiful. Like I experienced the cold and everything was just, but it was Christmas. It was a fun period. So yeah, so after the isolation period, I was also given a compulsory appointment with a health center to run tuberculosis tests, because backed up with facts, it is known that a lot African countries have a high level of tuberculosis. So since I was coming from an African country, it was important for me to like run the tuberculosis test, because the government here in Norway is trying to like manage that situation. So if for example you go for the test and you come out positive, the government would try to help you, give you the necessary medications and all that. So they just do not want the disease to spread, or the sickness, I don't know the right word to use, sorry. You will forgive me if I am not using the right terms in this video, because I am not medically inclined. So I'll just be using my own basic knowledge basically. So yeah, so I went for that appointment. Like a comprehensive blood test was done. The nurse literally took like 5 kgs or 5 liters of blood from me. Like I was so exhausted throughout that process. Okay, yeah, I'm exaggerating that, but it just felt like that. since I'm not the hospital kind of person and I hate needles, so the process just felt so long for me and all that. I would not want to go through those experiences again, obviously, because I dread it. So, but it says it's a compulsory process. Yeah, I had to do that. Tuberculosis, polio, yeah, HIV. Like, it was so comprehensive. Like, I had lists of like a whole lot of tests done. Yeah, and I was glad I did that because it just gave me knowledge. It just gave me knowledge about my health situation and what I needed to do, what I needed to not do, stuff like that. So I think it was just a very important process also for me, aside the need for the government and stuff like that. So yeah, and yeah, after that, a couple of months later, yeah, I discovered I was pregnant. So yeah, after I discovered I was pregnant, I went back to the hospital or the clinic, yeah, where I did the test because I wasn't yet assigned to a fast legend. Okay, yeah, a fast legend is just like a personal family doctor, that's your personal doctor that you're assigned to if you have a personal number or social security number. You this person is basically kind of caring for you, has like all your medical records, stuff like that. So if you need anything related to your health, this person's like your go-to person. Super helpful, super necessary. So yeah, so if there are like there's like a possibility, if you have a family here, there's a possibility that you can like join every member of your family to one fast legend, or if you want to also change your fast legend, which I would not know a reason to do that. Maybe you have a reason to do that, you can also change that. You can go to health.no, yeah, and like it's a website where you have like you can manage all your medical related issues. So you can do that, but I just figured I know that it will take a whole lot of time for you to change it, but it's possible. It's not like it's impossible. So yeah, so your fast legger who just was my fast legger rather was with me through the whole pregnancy journey, and also immediately I also got the results from the pregnancy confirmation. I was also assigned to a midwife. So the midwife is in like a health station. That's Norwegian. Yeah, it's like yeah, you go to the health station every time you have a midwife appointment. It's just like a hospital where they care for expecting or expectant mothers, and during their pregnancy, after pregnancy, and the baby as well. So let's talk about before the pregnancy. So the more is like the midwife that you are assigned to, literally works with you like step by step through the pregnancy, and they're super helpful. They're always available for you to ask questions. So you'd also go for like appointments, like checkups every, depending on how frequent it is and depending on the kind of pregnancy of course you have. So literally almost every month, or yeah, just depends. So you go for like an appointment. So during this appointment you go with the urine sample. You also do like a blood pressure test. You check your weight, and then they'll check your belly and the size of your belly. That's just to see if the baby is growing, to make sure that the baby is growing well and stuff like that. So as the pregnancy advances, they'll also do this I don't know the name, like the medical term for it, but they will have like they'll check the heartbeat of the baby and stuff like that with a liquid, and there's an instrument to use check the heartbeat of the baby, make sure that the baby is going well and growing well. Yeah. So as pregnancy progresses, you would also be signed up for an ultrasound. Now this ultrasound gives you the possibility of finding out the gender of the baby, and then yeah, just seeing the baby in your belly, stuff like that. And then you go with your partner. It's a separate clinic. It's not you don't do it in the health station. It's like a separate hospital basically, where you go and do this test. So it's It's free. Yes. Okay, yeah. Let me talk about this. Let me just talk about this. So it's a known knowledge that living in Norway is super expensive. Like everybody knows this already. But while you're pregnant, everything is totally free. Like once you know that, or once the system, once the government, once the hospital finds out that you're carrying a baby, every service you get is totally free. You get, this is the essence why you pay tax. Your taxes are high basically, because these funds are used to like take care of other situations. So once you're pregnant, you get services for free like that. There are lots of times where I go to the hospital, and then I would like to, when I'm about leaving, they'll be like, you don't have to pay and stuff like that. So it was completely new to me, because where I'm coming from, you have to pay for services like this, and it's quite expensive, especially if you want good services as compared to like what you're getting here. You'll have to like pay out of your pocket, like out of your nose basically. It's a lot of money. So getting good services, getting this care and all that, and you don't have to pay so much. It's just really cool, like really, and super helpful as well. So yeah, so where was I? Okay, so let me go back. So you go for the ultrasound. The ultrasound is also completely free, but if you have need, like a personal need, to have another ultrasound or something as the pregnancy progresses, you have to pay that. you pay that by yourself. You take care of that. But this first one that you are assigned to go for is completely free. After the ultrasound, you also get like pictures of the baby in your belly, which is so cool, because like you can like print it out and like put it somewhere in your house or something, which is totally cool. I just like the idea. Yeah, so that's a print it out. Yeah, you can like enlarge it, that's the word. Yeah, so that's so cool. And then after that, I remember I also went for the glucose test. The glucose test is in another clinic again, and that's also free. So this test is just to check your diabetes, check for that diabetes basically. So you're given a liquid, a very very extremely sweet liquid. Oh my god. My old self would have been so excited about this, but yeah, I'm trying to cut down on sugar and stuff like that, so it wasn't as exciting as my old self would have liked it. So you go to the clinic early in the morning on an empty stomach. You get this test done on an empty stomach. So yeah, you, after they'll check, you drink the liquid, and then you'll stay for like an hour or two, and then they'll redo a test on you, and then they'll send you the results. So that came out well for me. In fact, my pregnancy journey was smooth. Yeah, I would say it's smooth, aside the skin color discoloration that I had, and a little body changes here and there. Like generally it was smooth, because like I had no complications, so I didn't need to go for any extra checkup or extra tests and stuff like that. So yeah, well, when you were like in your 9th month, like couple of weeks to delivery, you also have like this appointment where you could go with your partner, and then they'll teach you about delivery, the entire delivery process. Like they're super, like when I tell you they're super helpful, they are extremely helpful. Like you can ask questions. You also have access to the midwife's phone number. You can call her if you have any challenge and stuff like that. And you also have access to your fast legger, who is also following you on this journey. So you have like 2 people following you on your journey, right? So yeah, if yeah, I'll talk about the delivery some other time. So yeah, the delivery process, yeah, they follow you up there too. So after the delivery of the baby, you would also get like a visit from in Norwegian they call it a helsesøster. This like you know, in English is like a health sister, like a nurse sort of kind of situation that is assigned to your baby. So from birth, your baby has a nurse that like follows her through, him or her, through the journey of the first year, basically stuff like that. So is the health exhauster came to the house like 3 days after I got back from the hospital. Oh yeah, staying at the hospital was also extreme, was free. I got like good services there. Like I was like, what, this happens here? Okay. Wow. And I got to stay in the hospital like 2 days, I think 2 3 days after, or like it's even like 4 days after delivery. And while I was there, I had nurses come by, doctors, we had like multiple tests on the baby before we were allowed to go home. But the whole process was okay, it was fantastic, and good services as well. So yeah, before you give birth, you're also given like an opportunity to choose between two hospitals. So because I live here in Norway, sorry, excuse me, because I live in Oslo, Oslo has like two major hospitals, the one at O level and the one at Akehus. Akehus is like the new modern hospital. O level is like the old one. So you get to choose which you want to bet at. You also consider, when you're making this decision, you have to consider proximity to where you're living and stuff like that, so you don't have to like drive for so long before you get to your the hospital, stuff like that. So yeah, I chose Akehus because it was quite close to where I live. So yeah, and once you do this is like done like in the eighth month, 7 months, depending on your more. And then they also they have to notify the hospital about your birth and all that. So while you go there, you already have like your data and all that. But you have to go with your medical documents though. You don't just go empty-handed, because you know they have your documents. So yeah, I have to go with that. So after that, the delivery, the health assistant came to the house, followed up with the baby, followed up, checked the weight and stuff like that, gave us tips on how to breastfeed. Like while you're in the hospital, you have nurses coming to teach you how to breastfeed, asking you questions, like trying to monitor the whole first moment, even bathing the baby and all of that. So you get all that help in the hospital, but the health assistant also follows up with that. She like goes through it, gives you tips, and then she tells you like anything you need. You have like a personal number, like her personal number. It can't be a man though, forgive me. This number you call anytime you have a challenge, yeah, or yeah. Okay, yeah. And apart from that, there's a hospital they call the Legevact. Now this is like the emergency hospital. This one you do not need an appointment to show up. If there is a situation that demands urgent attention, you go to the Legevact and then you get immediate help for that. So yeah, this is also for this is not just for pregnancy, this is like a general healthcare situation. So yeah, the Legevat is accessible 247 and they handle emergency cases. But if you're going to your fast legger, you need to go with an appointment, and your Yodmore, you need to go with an appointment. So that's just the difference between that. Yeah, I just thought to clarify that. So after the delivery, the Yodmore follows you up onto the 6th month, and then tries to monitor the situation, tries to also help you talk. You have like somebody that you can talk to about the whole process. If you need like a counseling session, if you need a psychologist, you would also get that, because a couple of people have postpartum depression, stuff like that. So yeah, you also have services to a counselor to discuss about your birth, your fears, and anything you just feel like talking about. Like you have someone there to listen to you and talk you through the process. So yeah, that also is free. They already know your birth story, but you have to like share with them, like do basic stuff like that. Okay, I also here in Norway, if you're like from 25, I think, up and above, are you female, you also get to go for this test where they like check your cervix to see traces of cancer. There's a medical name for it. I don't know, so I cannot remember the name. And so this in this test, they check your cervix and then see possibilities of you contacting or getting cancer in the future, and yeah, stuff like that. So yeah, you'd be booked for an appointment with a gynecologist. I am in my 20s, so I haven't had that before, so it was my first time, and yeah, it went well. I think the test is also done like every 2 years or thereabouts, so you have to like repeat the test constantly, but it's not as frequent like every year or every month. So you repeat that test, and it's free as well. You don't get to pay that. So yeah, I had a gynecologist do that test. And another thing, am I forgetting something? No. Okay, yeah, so yeah, your midwife also talks to you about family planning, give you options to use for family planning. So if it's something that you want to start family planning, they'll give you different methods to use to prevent pregnancy. And yeah, so that's also free. So if you decide to go with there's this one that you like put in your arm, stuff. Yeah, and then there are like other ones of, I don't want to talk about family planning, that's not my area ish, but like there's a possibility for you to take family planning. And yeah, if you're done with having children, stuff like that. And yeah, it's just in general, it's super cool. You get good care, like extremely good care, because family is very important to the Norwegian system. When you're pregnant, you don't get to pay for any service. And yeah, so if you were working before you got pregnant and you needed to stop, or you were working 50-50, or because of the pregnancy you had to, of course, you had to stop, you would be paid a certain amount of your salary, sort of, after the leave, like during your maternity period, your maternity leave. Yeah, so you still get paid if you were not working and you've never had job, sort of. And you, during your maternity period or during your pregnancy or before you deliver, you'd be given a couple of, like, a lump sum to help you with buying baby things, buying most of the necessities you'd use while the baby comes. So yeah, so it's either you get the lump sum or you get this amount every month, which is like almost like maybe half of your salary or almost your salary. Yeah, so you don't just stay at home without getting money and just trying to figure out how you're going to eat and stuff like that. So the government is super helpful in that area. So do not forget to catch that, to get that your money, because it's your money. It's very helpful. And you also have, your baby has banpenge. This is like the money that is sent to you every month, sent to the mother, yeah, every month for the baby. And I think you have access to that till the baby turns 18. Yeah, I think till the baby turns 18. I might not yeah, I think so. So you have like 1 year maternity leave, which you're supposed to share with your partner. So however you want to share that with your partner, you guys can like collaborate on that. But like, while you're in this leave, if you were working, you still continue getting paid, so that's good. And yeah, another thing, I was supposed to talk about something. I hope I'm not forgetting. Okay. And yeah, so 6 months after delivery, you still get care. And if you have any need, you can always still contact the hospital. Your fast legger is always there for you, or you can go to leg evac. So yeah, that's helpful. And another thing, yeah, try not to miss your appointments. It's so important, because the baby would have series of appointments for injections, vaccinations, and all that. So you also have appointments you can go with your partner, so you follow that up. It's very important. If you do not do this, it's more like negligence on your child. And the government system, the government is really against negligence when it comes to children. So whatever you're doing, make it a priority that you always meet up with your appointments for your baby and yourself as well. And please, I'm from Africa, and this is directed to the African community. Please do not do Africa man time when you're going for your appointments. I beg of you, it is unacceptable, and it doesn't just create a good image of you, right? So if you have an appointment, please try and go there early. If you have to leave the house like an hour before time, so that you just meet up and you even go there and sit and wait, it's better than going there late, because like everything is always on record. You don't know, then one day they might just be a day of recording and it will be against you, sort of stuff like that. So just to create a good impression, try and go for your appointments earlier. And what else? So yeah, that's just like it's a very cool experience. You are basically not lonely through your pregnancy, and you get to get facts. Like you don't just use fairy tales or myths to run your manage your whole process, the pregnancy and after pregnancy process. You just get facts, and then so your toddler also has this medical care that they need. So yeah, so I would, if I'm to compare having a child here in Norway to Africa, where I'm coming from, I would choose Norway, and over and over and over and over again. And I don't think there will be like this another country that is this caring. I don't think you get all this services in another country, like outside Norway. But I don't know, I haven't lived in a lot of places. I'm just sharing my personal experience. So yeah, thank you so much for staying with me up until this point. If there is anything I am missing out, I would make a video for it. You can comment that in the description, and I'll make a video for it. And if there's something that and I'll also share the best story in next video, so watch that, wait for that. That's coming up soon. I hope this was super helpful to somebody, and if you're planning on coming to Norway, please do come. We'll be happy to have you. Yeah, so thank you for stopping by. Thank you for being patient with me to the end of the video. I am very, very happy to be back. So yeah, I was just trying to navigate the whole having a newborn, combining school, stuff like that. But yeah, I'm back, and I'm happy to be back, and I hope I would be here more frequent. So please help me share this video to someone who you think it will be helpful to. Like, comment. The more you like, the more visible this video would be to somebody else. So try and like this video, share it to somebody you love, your friends. It will be super helpful to me, and it just gives me a whole lot of joy to see that somebody, even if it's one person, sees this video important and finds it necessary to spend a minute of their time. So I'm grateful. I do not take it for granted. Thank you very, very much, and I hope to share more better content, more helpful content in the future. It will be bye for now. Thank you. This is like the thank you dance. Yay, I'm so happy. Finally, we've come to the end of this video. Bye. Have an amazing day ahead, an amazing week. I love you. Jesus loves you more, of course. Bye for now.